Let's take a look at the sexual response cycle again. This time we're going to talk about what happens in women, and we'll find out that really a lot of the characteristic things that are describing excitement, plateau, orgasmic, and resolution phase, it turns out that those are very similar in men and women. Just again, the body parts are slightly different shapes here. There is a little bit of variation we can discuss between men and women. So again, you'll go through this phase of becoming excited, right? We'll get to a plateau and an orgasm. And what's really interesting about women is there is no refractory period. So we can just head right on into a second orgasm, right? So there is a number of people in the population, about 14% was described by Kinsey. Those studies are a little bit dated, but there is data out there indicating that there are women that are capable of multiple orgasms, one right after another. Okay, some variations here as well. Again, with the male system, because orgasm is so tied to that explosive release of semen, sometimes women don't achieve that during their sexual response cycle. So it is possible to go into and achieve plateau, but then to a never achieve orgasm. Again, you do have some articles to read on another post that talks about sexual dysfunction, primary and secondary, and kind of what goes on here, why someone wouldn't achieve an orgasm. Is it a psychological reason? Can they not get into a parasympathetic state and they're not okay with their partner? And perhaps they can achieve orgasm in another set of circumstances and go through these other phases. Or is there actually something wrong with their body? And one of the things that I'm very happy to report is because of the way things are diagnosed now and because of this information that Masters and Johnson set out there, we were able to study and grow, and we know a lot more in these current years and era, that a lot of it really is a secondary orgasmic dysfunction, meaning you're just not mentally there, you're not okay with your partner, you're not okay with the situation. Okay? And you can achieve orgasm under other circumstances. Primary would be the most concerning, is that there is actually something physically wrong with the tissues. Okay, let's go ahead and walk through these female responses. So we'll start with excitement because that is the first phase. And surprise, surprise, we see a vasocongestion here. Again, blood flow coming into an area, but we're not letting an equal amount of blood flow out. So that area starts to swell in, and often we see those tissues deepen or darker in color. So one of the places that gets increased blood flow is the uterus. So it's going to start to expand in size. The vagina is going to deepen in color. And the clitoris, remember, is homologous to the male penis. It's going to undergo tumescence just like the male system. So if we look at our two figures here, we can see the glands, just that external little pencil eraser bit of the clitoris sticking out. And as we move into excitement, we can see that clitoral hood, the prepuce or foreskin of the clitoris, is going to be able to pull back. And we can see that this tissue has now swollen and it's becoming aroused or excited. Okay, the labia minora, which are going to be bordering the sides of the clitoris and the vaginal opening, those are also going to swell. So we can see those tissues are thickening up a little bit in this image as well. One thing that you may not realize is your breast tissue actually swells during a human sexual response. This is due to fluid accumulation. Okay. The nipples will become erect. They are absolutely an erectile tissue, but the actual entire breast itself tends to swell up and look a bit larger. Okay. Women will also experience a sex flush. It's a little bit more common in women versus men. Okay. Again, this is a vasodilation response where there's more blood flow that's going to be to the face, to the chest, abdomen, to those areas. So the skin's just going to look darker or redder in those areas. And of course, women will also experience this myotonia, this little bit of an increase in skeletal muscle tone across the whole body. Also in the excitement phase, so we can talk about what's going on internally. So the vagina is going to become lubricated. There are a number of glands that are within the walls. Those are going to secrete some fluids. And the vagina is actually going to start to stretch out, increase in length and width. Okay? This is before intromission even occurs. Okay? So don't force anything, just be patient, allow for this to happen. So the inner 2/3 of the vagina, so from about here to here, this is really where we're going to see the change. Remember, the vagina have rugae or wrinkles that are going to allow it to expand and increase in size. So this is a little bit of a strategy here. We're kind of making room for the organ of intromission, the penis, and then we're creating a little bit of space back here right next to the cervix. That's going to be the place where semen's going to be deposited. So we need to give it a little spot to go. The uterus body is also going to start to tent. So remember, the normal or most common position for a uterus is in this anteverted position up top of the bladder. And what's going to happen is, as we start to get excited, so does our uterus, and it's going to start to stand up in this tented, very vertical looking position. And you might feel a little bit of a uterine contraction when this happens. If it's an irregular contraction, it's called fibrillation, just like a heart experiencing irregular contractions, only this is not a heart attack. This is something that is forwarding the sexual response cycle in the uterus. And then the labia majora, again, think of them as being very similar to the scrotum. They're going to flatten and get out of the way and help to create that sexual platform. Okay, once we're in plateau, a lot of it's really just more of the same. Okay. And the labia minora, just like the labia majora, they're now going to kind of swell up and get out of the way. Again, more of creating that sexual platform. There's more vasocongestion, and we had described the back part of the vagina was kind of stretching out and tenting and expanding to allow for the penis to be inserted, and then also, again, giving a little bit of a space for semen to be deposited. But the this outer third is going to contract. And that's basically kind of clamping down and not letting the penis get away or get lost or pulled out. Because, again, our body is trying to make pregnancy happen, trying to make reproduction happen. So that outer third of the vagina is going to clamp down while the inner 2/3 is going to make room. Okay. Interestingly, what should be in its final moment, the clitoris is really going to retract and kind of hide underneath its clitoral hood. And it's going to pull back and get out of the way. There is, theories out there, possibly, too much stimulation can be, very intense for that clitoris. So it's actually going to undergo a response where it's hiding underneath its clitoral hood right before we enter into orgasm. If the uterus isn't already tented, it's going to continue to contract and pull upwards. And then again, more of the same as far as heart rate going up, blood pressure, breathing rate, and that increased muscle tone or myotonia. Okay, and then orgasm is going to follow there soon after. Okay, anything that you've been experiencing, sex flush, that's going to continue to happen. And then really specifically, we go through these very characteristic muscle contractions and oxytocin release. So we're going to have really strong contractions in that outer 1/3 of the vagina. Okay, and they're going to occur 2 to 4 seconds, and they're going to occur at exactly 0.8 seconds apart, which is just like the male system. So we're thinking of all of those ducts and structures in the male system contracting. We're getting the same types of contractions here. They're going to be very rhythmic. The uterus is also contracting. This is thought to be a mechanism as semen is deposited here, the sperm cells are going to have to start swimming and head up the cervical O's. And it's really thought that they move through the uterus faster than they can swim. So really a function of a female orgasm that has been theorized is that uterus is going to start contracting and kind of pulling the semen and pulling those sperm cells upward. So they actually don't even really have to swim that much. They're just getting pulled in the right direction. Okay, there might also be some involuntary muscle contractions, again, with all of that myotonia. So not just what's going on in the genital region, but there could be facial expressions, clutching, clawing of hands and feet, just like we see in males. Moving into the resolution phase, we're just going to undo everything we just did. So heart rate, blood pressure, breathing rate, everything's coming back down to normal. You might actually get sleepy or sweaty. That cervical O's, like I said, is going to dilate. Again, that cervical O's is going to be the entrance to the uterus. Like I said, that uterus had just been contracting in the orgasmic phase under control of that oxytocin, that bonding hormone release. And widening that O's is just going to further facilitate any semen that hasn't already been kind of pulled up into the uterus. It's going to allow anything else to kind of swim and move in that direction. Okay, and we're simply going to lose our myotonia, that sex flush, any type of vasocongestion. The uterus is going to lay back down in its anteverted position. Okay, and then I want to talk about the female orgasm variations. So we already mentioned that multiple orgasms are possible. Women do not have to go through any sort of refractory period. They can go from excitement plateau, orgasm, straight into another orgasm, straight into another orgasm. Okay, the status orgasmus is worth mentioning. This is a sustained 1-minute orgasm. So typically we're just getting a couple muscle contractions during orgasm. Those are at that 0.8 seconds apart. And at most, people usually get like 15 of them. If you can get them to go for an entire minute, that is the sustained orgasm or status orgasmus. Okay, and then finally, let's just put this to bed. Clitoral orgasm is a vaginal orgasm. This is a view of the internal clitoris, and I don't know why they don't put this in more textbooks. It's actually really frustrating, like this doesn't exist. So I always put this in my lecture so that we can see that it's not mythical. There is actually a good bit of the clitoris that we can see inside the body. So this is an interesting view. This is not quite a frontal view. This is kind of like an elevated looking from a downward angle into a woman's body from the front. Okay, so everything that's here in blue, okay, this is going to be uterus, this is going to be ovaries, okay, and then everything here that's in yellow, okay, this is going to be clitoral tissue. So typically we just see the tip of the iceberg here, that little pencil eraser bit that is sticking out and has that glans. And that's what we were focusing on during the sexual response cycle. But look at this. There's so much more to the clitoris. There are internal structures here. There are crura, just like the male system or the root of the penis anchoring to the body. But then also look at this piece. This piece of the clitoris wraps completely 360 degrees around that blue vaginal structure. So you can stimulate the tissue here, okay, or you can insert the penis into the vagina and you can stimulate the tissue from all different angles. Okay, so whether you stimulate the tissue here or you stimulate the tissue here, you're going to get an orgasm. So there is no difference between a clitoral orgasm and a vaginal orgasm. Some people often ask about the G spot. So that's this theoretical spot, which is really able to achieve orgasm in females. And guess what? Equal amount of papers say it does and doesn't exist. It's hard to dissect a human and say, oh, there's that tissue there, because it doesn't look any different. But I think what we're aiming for, or what people are describing, is really going to be that point where you're contacting the clitoris from inside the vagina. Okay, and now we're on to the summary slides. So again, in your studying, I would just study each of these figures, make sure you can walk your way through what's going on in terms of excitement plateau and resolution in terms of the female anatomy. Don't ignore what happens at the level of the clitoris and the breast tissue, and then also make sure that you can interpret this sexual response cycle figure as well.